other countries who are trying to take our model and build on it, and maybe even build it on it faster than we are. But there's no question that of the things that the government has done that have benefited all of us, medical research ranks very highly on that list.
You mentioned China. Are there other emerging countries, areas of the world that are kind of catching up to the U.S. as far as medical research?
If you look at countries that are investing a larger proportion of their GDP in research than we are, actually the list is getting fairly long, but China, India, Brazil, South Korea, Europe, England, all of those, despite what is in many instances difficult economic circumstances for them as well, see investment in medical research as an opportunity both to advance health and to grow the economy, because this is the kind of investment that has lots of spin-offs. Here in the U.S., you can see that the dollars that NIH supports in terms of grants to universities all over the country directly support about 480,000 jobs. But if you count all the spin-offs, it's more like 7 million jobs, high-quality jobs, jobs that the rest of the world would love to take away from us. So it is a very strong economic argument as well as a health argument.
Senator?
Well, it's interesting. It's competition being used as a way to expand the reach of not only private companies but governments as well. And that's a big challenge for us to overcome. And so we need to get used to the fact that we're going to have to invest public dollars along with encouraging through the tax code or otherwise investments by the private sector to the fullest extent of our capability.
What about, you mentioned that kind of towards the end of your presentation, the NIH and the grants, I think there was like 1 out of 5?
1 out of 6.
1 out of 6. Can you talk something about that, kind of flesh that out for us, the difficulties that you have?
So the way NIH spends the taxpayers' dollars that are given to us each year is to solicit the best and brightest ideas from scientists all over the country, including quite a few of them here in Mississippi. They send their ideas to us in the form of a grant proposal. Those are reviewed in the most rigorous system in the world, a peer review process, where other people who are experts in that field look at the proposal, decide what its merit would be, assign it a score. And then we look to see how many of these grants can we actually fund. Ultimately, over the course of the last 50 years, the answer has been about a third have been fundable with the dollars that we had available. But over the last few years, that has gotten much tighter, and we're down now to about 1 out of 6, which makes it very stressful, as you can imagine, if you're the investigator who's written a very innovative grant and sent it off to NIH, and you get back the note saying, sorry, you didn't quite make it, we kind of like this part, but it wasn't quite to the point where we could fund it. And then you have to try to rewrite it and resubmit it, and after a while, after too many rejections, people really begin to get discouraged. We are at a difficult point right now because of all the economic struggles of our nation. But I do worry that our biomedical research workforce, the scientists working here in Jackson and lots of other places around the country, are our most important resource. They're the people we're counting on. That's a future. We have to be sure that we don't let them down.
On that, Senator, UMC is a research hospital, so how important is what he was just saying? How does that apply to Mississippi research?
Well, I think the likelihood is that we're going to see heightened competition for available federal dollars that are getting scarcer as we go along. It's a big challenge, a lot of military challenges and things that threaten our national security. We have to be prepared to defend against. Keeping our economic opportunities alive and well for investment, private sector people and corporations who want to broaden their base of customers and do the things that they are organized to do for the benefit of the whole country. So there's a lot of competition out there. But we are the strongest nation economically in the world, and if we don't do it, who will do it? So we have to recognize that too as a humanity demand on our time and energies and our wealth as well.
Let me say we're lucky to have Senator Cochran in the Senate at a difficult time like this where hard decisions have to be made. He's been a wonderful leader for Mississippi, for medical research, for trying to make the right decisions even when there aren't any easy decisions to face you most of the time. I'm sure you would agree with that.
Dr. Collins, one of the points that was touched on this morning is about sort of the follow-through. So the NIH is sponsoring a lot of scientists who are also training postdocs and grad students. And you mentioned about following, sort of closing the loop on how do you know that they are becoming junior investigators and moving up the ladder. What's in place now, and what are your thoughts for the future?
So I convened a very distinguished group of experts about science education to advise me, and they worked hard over the course of the last year. The group was chaired by Shirley Tillman, who's the president of Princeton. And they made a number of recommendations. First of all, we have to recognize that the training that NIH supports is the largest support of biomedical research for the next generation. But that not everybody we train is going to end up in a university as a professor. In fact, only about 1 out of 4 end up in that particular path. Others end up in industry, in biotech or pharma, or they end up in other places like full-time teaching or science policy or journalism. And we need to be sure that the way in which we're doing the training prepares people to consider all of those possible pathways and figure out what's the best fit for them. And don't pretend that somehow everybody is going to end up becoming a clone of their university mentor, which sometimes has been the assumption. We also are clearly needing to have better means of tracking what happens to people that we train. And even the suggestion was made we need a universal identifier. People would need to be comfortable with that so that we'd be able to know 40 years from now. If somebody publishes a paper, oh, is that the person that we trained 40 years before in some NIH grant, and now we can see what they're working on, and that's really good to be able to know. It seems pretty basic, but until recently we haven't really had the ability to get that information in a systematic way.
Yeah, it's hard to follow people. Senator, I wondered, in your view, and kind of taking off of that, in your view, with the opportunities for young people here who are in grad school or postdoctoral fellowships, what do you see as important infrastructure to be working for to build in Mississippi, whether it's new scientists and faculty members at a place like UMMC, or bringing in biotech companies or private companies, or what are you focusing on?
Well, I think, we used to think about recruiters on the college campus, as I can recall as a senior at Ole Miss, being visited by a couple of companies. IBM was one of them, as a matter of fact, and I recall being very excited about the challenges of a new company or a newer company doing exciting new things, and thought that was a company I might like to go to work with. But then I had an obligation to go into the Navy as an officer because I'd gone through 4 years of Navy ROTC program opportunities, and ended up changing my mind when I was in the Navy and deciding to go to law school instead. But I think the recruiters on the part of private industry are going to have to invest time and attention identifying those who are interested and capable of participating in a scientific career, whether in sales for a company or in further research, going to graduate school, getting PhDs. We're the richest country in the world. We have more opportunities in the U.S. for realizing one's dreams and hopes, whether it's altruistic, like doing something for others, or for private gain, which is not against the law. It's encouraged by our economic system and rewarded very generously, more than any other place in the world. So we're very rich, this is what I'm saying, in human and economic capital and assets and resources. So it's a matter of just making a determination that that's how you're going to set your goals, and that's how you're going to reach your star.
Anybody have any?
If you could, I'm sorry, I apologize for being late. Could you kind of, recap of simply why, you're here today, and tell us a little bit about why you're here today, sir?
Well, I'm here today because I was excited that NIH and others involved in the goals of this meeting were coming to our